Today, I'm bringing a detailed summary of Chapter 8 of the Art Therapy Handbook. This chapter mainly discusses the theoretical development of art therapy in the UK, the theoretical perspectives of different orientations, and their influence on contemporary art therapy practice. At the same time, it also focuses on how developmental psychology, neurobiology research, and new technologies affects the mood and future direction of art therapy. First of all, let's talk about the theoretical orientation and development background of contemporary art therapy in the UK. The chapter begins with a review of the theoretical development of art therapy in the UK, emphasizing that it has been influenced by various schools of thought, such as psychoanalysis, psychodynamics, humanism, and behaviorism. Difference in hospital versus community work models. The workplace of an art therapist may be a hospital, a community, an individual studio, and etc. The needs and resources backgrounds of different settings lead to therapists having to be flexible in their art therapy according to the client's needs and environmental conditions. The triangular relationship model book mentions that in art therapy, there is usually a triangular relationship of clients or patients outwards therapist. This model shows that in a therapeutic setting, the artwork is both a medium for the client to express his or her inner world and an important channel for the therapist to observe, understand, and give back. Traditionally, some art therapists prefer to work in a studio setting, valuing the client's self-exploration through creative freedom, while the therapist observes, responds, or intervenes moderately. This orientation usually emphasizes the autonomy and healing power of artistic creation itself. Jones' inspiration for art therapy. This chapter repeatedly mentions the influence of Jones' ideas on the development of art therapy in the UK, such as the active imagination technique, the emphasis on the collective, subconscious, and archetypes, etc. June's theories emphasize the connection between the symbolism of the image and the individual, collective, unconscious, and these perspectives are applied in art therapy to understand the symbolism and underlying meaning in the client's work. The book mentions the emphasis of theorists in the British independent tradition, such as Bion and Winnicott, and etc., on the concept of object relations and containment, and the treatment relationship as an important space for the client's psychological dynamics, such as projection and transfer. These theories are also integrated into art therapy practice to help clients deal with emotional and psychological conflicts in their work and therapeutic relationships. Art therapy and children development. In this chapter, it examines the research of developmental psychologists on the emotional, cognitive, and social development of infants and children, and how these studies influence the art therapist approach to working with children and adolescents. Bowlby's attachment theories has an important place in art therapy. Different attachment styles, such as secure, anxious, and avoidance, are described in detail, and it is noticed that attachment patterns affect how individuals interact with therapists in art therapy. Verbal and non-verbal expression. Stern emphasized that infants and toddlers have rich emotional and social interactions before the advent of language, and that art therapy can provide an alternative avenues for communication and self-expression for clients with insufficient or limited language through visual and creative means. Recent neurobiological studies have shown that emotions and early attachment have a profound impact on brain development, especially the quality of interaction with caregivers in infancy and early childhood, which affects the individual's ability to regulate emotions and social behaviors later in life. Some studies have shown that creating or interacting with art materials may provide a restorative experience for children who have been traumatized or at risk for development. Art therapy helps to activate areas of the brain related to emotion, memory, sensory integration, and promotes positive connections. The book, Trauma and Stress, also mentions that art therapy can be used to assist in dealing with traumatic experience in child and adult. On a nonverbal level, art therapy provides a relatively safe space for traumatized individuals to express themselves and help reduce stress and anxiety. Narrative and identity construction in this chapter emphasize the narrative as an important means of psychological integration. Through the telling of their own stories or the presentation of their own experience in artwork, the person can gradually construct a more coherent self-image and with fragmented emotion and experience into an intelligible stories. The interweaving of artwork and narratives is an art therapy, and creation itself can also be seen as a process of narrative or externalization. Post-creation discussions and interpretations can help the clients to gain a deeper understanding of inner conflicts or emotional experience. The UK government policy and funding. The latter part of this chapter mentions some of the UK's new initiatives around mental health, such as the IAPT program, emphasizing the importance of short-term treatment sessions and effectiveness evaluation. Art therapists need to continue to demonstrate the clinical effectiveness and cost effectiveness of art therapy for clients under this policy and founding guidance. The use of new technologies and social media technologies and the popularization of social media have had a huge impact on the social, emotional, and psychological states of adolescents and adults, and art therapy has begun to explore new forms such as online platforms and digital media. Digital art and teletherapies in some therapists try to digitally draw, use mobile apps or other forms of interaction with clients in an online environment. Ethics and boundaries also raise concerns about treatment boundaries, such as the potential for role confusions when interacting with clients on social media, or challenges to privacy and confidentiality principle. The theoretical and integration in this chapter presents the multifaceted integration of British art therapy theories in the historical development, including psychoanalysis orientation, Jungian orientation, object relations theory, developmental psychology, neuroscience, and etc., and various perspectives are applied in different fields and objects. Overall, this chapter provides an overview of the main theoretical foundations and the evaluation of practice in the UK, and explores the possible future direction of art therapy in the context of technology, policy, and interdisciplinary research. It emphasizes the interaction between the therapeutic relationship, the artwork, and the client's inner world, and reminds therapists of the need to constantly balance the influence of clinical practice, rationale, and change in the external environment to maintain and expand the values of art therapy in the field of mental health. Thank you for watching, and we look forward to seeing you in the next video.